We are in Korea. PAs are being used to replace doctors. And this seems to be the case for various reasons, from doctors being overworked, underpaid, to fewer doctors applying for surgery and emergency medicine. The Special Act on Resident Training Environment. This law restricts the amount of hours the hospital can demand from its trainees. The doctors were just being They were complaining of the same issue our bros from another mother are complaining over here. When you add on top this law, naturally a gap opens up. The institutions were like, we can look at the US and how they dealt with the shortage. We can just drop these PAs there and it'll be fine and dandy. The air quotes. These PAs are not really PAs like us. They look like us, they walk like us, they smell like us. You, me, they ain't treated like us. And frankly, I suspect this was the case for Taiwan as well before the establishment of the first PA program in Fuyin University. Like Taiwan, they are mainly using nurses to work as PAs, though there are a few paramedics and an occasional military personnel in there. However, unlike us, they have no formal training. The claim is they learn on the job. That does not really cut it in my books. And this is why, when I was comparing physician associates to doctors in this video, go watch it, I argue that one cannot truly know something unless they've been tested for that knowledge, which then followed that though physician associates are not doctors, because of the tests they've gone through, their knowledge as PAs have been verified, and that is what makes them physician associates. Our bros in Korea have not done any version of that, and because of that, they are not approved by ZEOS. To make sure I wasn't bugging or hating on my own people, I decided to have a closer look at what this training they claimed they were getting on the job was all about. Survey looking at 35 hospitals. Of the 189 physician associates that responded, over 60% did not have any PA training before they started the job or after, regardless of the lack of any formal training. There was no informal training. When there was any such training, it was just one day. Just one day, teach you a bit of stuff, now you can play the PA role. And occasionally there were a couple of dons that were trained for 3 months. I'm not bagging. Them bros in Korea, they are not PAs. Not by any stretch of the imagination. They are PA wannabes. Man, I sound like doctors calling PAs nocturs. They are practicing, and most of them seem to be in surgery, assisting surgical procedures, examining patients, taking history. The cherry on top, some of them can actually prescribe, though there seems to be a defined pathway of medications that they can prescribe. But nonetheless, they can prescribe, and our little asses are still here and we still cannot prescribe. Please hurry up. Let me write ibuprofen, naproxen, Fenbid. Which one do I like again? The Korean Medical Association are definitely not happy with the current state of affairs, calling for a closer look into all this illegal PA business. They argue patient safety, medical legal liabilities, and the impact this has on the training of doctors. They are asking for a formal structure akin to what we have in the UK or the US to allow some checks and balances. Though the homies are trying to take inspiration from the UK, from the United States, and develop their own thing. But come on, no training at all, maximum 3 months, and normally 1 day. Bro, that is not cutting it. The OGs in the United States, they went to Duke University, graduated, and then hit the streets. Build your street credit first before you hit the streets. And to be fair, the Korean PAs do agree that it's definitely not ideal, as they are caught between the limbo of am I a nurse or am I a doctor. I think the homies should go back to the drawing board, get things done properly, and when they come back and they are proper PAs, they'll join La Familia. We can go have pizza, we can go dance bachata. But right now, what they have right there is not approved by ZEOS. It's your boy OT. And I'm out. Salute.